Hi, I'm Jenny. I'm going to be doing your full body assessment today. Is that what you came in for?
Yes.
Okay, first we're just going to start with your skin. And when I'm looking at your skin, it is tan in color. There's no macules or lesions present. The skin is warm and smooth. There's no abnormal contouring. Can you lift your hands up for me? Good. And we're going to be checking your skin turgor, which appears to be normal, which is telling me you have good hydration. I'm going to look down at your lower extremities, which are consistent with the upper extremities. They are tan in color. They are smooth. There's no abnormal contouring. They are warm to the touch. Looking at the lower legs, there's no varicosities or edema. And we'll check the skin turgor down here, which is normal, showing good hydration. Can you take your nails and go like this? Good, and then just do your thumbs. Good. So the nail beds are at a 160-degree angle. There's no clubbing or abnormal contouring. Can you hold your hands out for me? And cap refill is at less than 3, and we're going to do the same down on the feet. Toes are noted to be equally as warm as the upper extremity, and cap refill is less than 3. All right, so now I'm going to look at your hair and your head. The head is round and asymmetric. It's midline and upright. It is symmetric bilaterally. The hair on inspection appears to be thin and black in color. There's slight gray hairs noted, but the distinction is continuing with the male distribution pattern. And on inspection and palpation of the hair, it is thin and dark with gray, equal to male distribution pattern. There's a slight balding pattern on the posterior aspect. It is clean and well maintained. There's no evidence of infestation. All right, will you look up at me? And we're just looking at the scalp here, which is freely movable. Are you having any pain?
No.
There's no lesions or abnormalities noted. Are you having any pain here?
No.
The parasinuses are non-tender. Alrighty, so now we're going to look at your neck. If you can just swallow for me. Good. The trachea is midline and symmetric. There's no abnormal bulges noted. No jugular vein distension. Slight pulsation noted, but no other abnormalities. I want to test your cranial nerve 12. So what I want you to do is shrug your shoulders. Good. And then turn your head from side to side. And we're going to do that against resistance. Shrug your shoulders, and then from side to side. Very good. We're going to test your range of motion. So chin down and head back. We're going to do from side to side, and then from ear to shoulder and ear to shoulder. Very good. I'm going to test some sensation on your face. So tell me when you feel sharp or soft.
Okay.
Okay, ready?
Soft. 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 Sharp. Soft.
Very good. All right. And all of those were within normal limits. Now with your neck, I'm going to take a look at your lymph nodes. I want you to let me know if anything is abnormal or feels tender, okay?
Okay.
So we're going to do the pre-auricular, the post-auricular, the occipital, the retropharyngeal, the submaxillary, the submental, the anterior, the posterior, the deep, and the clavicular, which are all non-palpable. And were those tender for you?
No.
Okay, very good. Now, just going back to your neck, we're going to look at your arteries, your jugular arteries. And there's nothing abnormal noted, no bulging. Shut this door. And if you just want to, we'll turn you a little bit this way. And I'm just listening. There's no bruits heard and no jugular vein distension noted. Next, we're going to look at your carotid arteries. We're going to look at your thyroid glands. So we're going to turn you this way. And go ahead and swallow for me. Good, and swallow. Good. We're going to test the right side first, so I'm going to tilt your head forward. And, we're going to do the left side and turn your head to the right. And the left thyroid is freely movable. There's no massage or bulges noted, no calcification. So we're going to turn your head to the left and do the right-hand side. And this gland, the thyroid gland, is consistent with the left side. There's no calcification. It's freely movable. Any tenderness upon palpation?
No.
Okay, good. Alrighty. Next, I am going to look at your eyes. So first, we are going to look at your eyebrows. Your eyebrows are dark in color. They're thick. They're equal and symmetric on both sides. The eyelashes are thin, equal bilaterally. They round up. There's no abnormal lesions or macules or abnormalities noted. The palpable fissures are distinct. There's no lid lag. Let's see. You can keep your eyes open. The conjunctiva is white. The conjunctiva is pink. The sclera is white with some vessels noted. Go ahead and close your eyes for me. Any pain?
No.
And there's no tenderness noted with the lacrimal sac. We're going to be doing a couple of different tests. So first thing I want to do is just check your pupil reactions. So you can just look straight towards me. Got it. Okay. The pupils are direct and consensual. They are symmetric to the light reflex, and very good with that. Next, we are going to do a test that's going to be doing your cranial nerve 2. It's called the confrontation test. So whenever you see the bunny, I want you to tell me, okay?
Okay.
So go ahead and cover one eye, and you just tell me when you see the bunny, okay? You can just say yes.
Yes. Yes. Yes. Yes.
Good. And keep that covered.
Yes. 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 Yes.
Very good. All right, you can uncover your eye. He saw the bunny when I did, which was a normal finding. The next, we're going to test your cranial nerves 3, 4, and 6. So what I want you to do is follow the pin light, okay?
Okay.
The light's not going to be on, so just follow it with your eyes, okay? Ready?
Mm-hmm.
Good. And there was no abnormal or prolonged nystagmus noted with the testing of the cranial nerve. Very good. Okay. The next test that we are going to do is going to be called a cover test. So what I want you to do is focus on my finger. You can keep your head straight, just turn your eyes. Cover one of your eyes. Good. And then take your hand away. Very good. So the eyes maintain balance, which is what we were testing, which is normal. And all of these tests would be done bilaterally on both sides. So next we're going to actually look into your eye. First, we would turn the lights off. I would be 12 inches away from the patient, and this would be able to allow me to test for the red reflex. So when looking into the eye, red reflex is present. The optic disc is noted. The macula is a creamy yellow color. There are some vessels noted. There's arterial and venous vessels. The arterials are slightly brighter than the venous. There is no crossing or nicking noted with the venous vessels. From the fundus, we would look into the optic disc, which would be 1.5 millimeters in diameter. It would be round in shape with distinct margins and no cupping noted. From there, we would see the macula, which would be a cloudy gray color, and in the center of this would be the fova centralis, which is the center of, or the clearest site of vision. Okay? Very good. All right, so next we are going to move to your ears. So when I'm looking at the ears, you can turn your head this way. The helix is reactive. It is symmetric on both sides. Any pain at the mastoid?
No.
And no pain noted at the mastoid. So I will come over here. There's no lesions or macules noted on the outside of the ear. The color is consistent with the rest of the body. When looking in the ear, there is slight hair noted in the external canal. The tympanic membrane is a pearly gray. The umbus, the mellis, the pars tibia, and tenos are all noted. There's no bulging or scars noted on the tympanic membrane. The ear overall looks clean in the external canal. So now we're going to do a couple of hearing tests on you, okay? I'm going to whisper a few words. This is called the whisper test. Into this ear. Can you cover that ear for me? And then I want you to repeat them back.
Okay.
No, I'm going to say the 3 words, and then I want you to tell them back to me.
Okay.
Okay?
Basketball, soccer, and hockey.
Very good. Okay, you can put your head down. Next, we're going to do the Weber's test. So what I want you to do is tell me where you hear the vibrations, right ear, left ear, or both, okay?
Okay. Right ear. Both ears.
Okay, very good. Next, we're going to do the Rhines test. So I'm going to put the tuning fork on your mastoid. I want you to tell me when you stop hearing the vibration, and then I'm going to take it off, and then I want you to tell me when you stop hearing the vibration, okay?
Okay. I hear it.
Tell me when you stop.
Stop. I don't hear it.
Okay, and that's testing cranial nerve 8, and the air conduction is greater than the bone conduction by 2 to 1. So now we're going to look at your nose, and the nose is symmetric. The skin coloring is consistent with the rest of the body. There's no lesions or macules noted. Any pain?
No.
Okay. Can you lift your head up for me? The mucosa is moist. The turbinates are present. The septum is midline, and there's no deviations noted. Can you put your chin down? Can you cover one nose and breathe out? And then cover the other nostril and breathe out. Good. We're going to test your olfactory nerve, which is the first cranial nerve. And I have 2 different scents for you here. I'm going to have you close your eyes, cover one nostril, tell me what it is, and then the next and tell me what it is.
Okay.
Okay. Can you smell?
I can smell it, but I don't know what it is.
Does it smell like garlic?
Kinda.
No, it's garlic.
Okay.
All right, cover your other nostril and close your eyes. And tell me what you smell.
I can't tell what it is. I can smell it, but I don't know what it is.
Pepper.
Pepper. Okay.
So we would note that the patient has been unable to correctly identify both of the scents. All right, we are now going to look into your mouth. The lips are pink and moist. They are not chapped. There's no lesions noted, no abrasions, or any abnormalities. Can you smile for me? Let me see your teeth. Good. The teeth are white and clean. There's no breakage or lesions or abnormalities noted on the teeth. Can you open your mouth for me? Stick out your tongue. Say ah.
Ah.
Good. The uvula rises midline. Stick your tongue out for me again. Can you wiggle it side to side? Good. Stick your tongue back out. The tongue is moist and is rogate. Oh, I'm sorry. The tongue is moist and there's no abnormal lesions or ulcerations noted. Can you smile? Let me see your teeth. The gums are consistent with the lining of the teeth. They're not protruding over the teeth line. Can you open up? The Whartons and Simpsons are noted. There's no lesions or abnormality on them. Can you go ahead and stick your tongue out and move it around again for me? This is testing cranial nerve 12. The gag reflex swallow, the rise and fall of the uvula are all testing cranial nerve 9. Okay. And open your mouth again for me. Look up. Good. The hard palate of the mouth is rugate and consistent with the soft palate of the mouth. The superior frenulum, can you open your mouth? I'm just going to look up. The superior frenulum has been removed, but all the other frenulums are noted and smooth. Okay, very good. All right, so we are done doing your head and mouth and nose and all of that kind of stuff. So now I'm going to look and listen to your lungs, okay? So if you can take your shirt off for me. And I'm actually going to get you to stand up and turn this way in the chair. You can sit facing this way. Very good. Alrighty. Assessing the lungs and the chest, respirations and palpitations are noted. The hair is consistent with male distribution. There is no abnormal macules or lesions noted. And I'm just going to palpate and feel. Any pain?
No.
No pain or tenderness upon palpation. No bulges, massive, or masses identified with palpation. Alrighty, so I'm just going to come to the back here. I want to test tactile fremitus on you. So anytime you, I move my hands, I want you to say 99, okay?
Okay.
Ready, go.
99. 99.
Very good. And vibrations are symmetric on both sides. I'm going to come down to the 10th rib. Sorry. Take a deep breath in and release. And we have symmetric movement on both sides with inspiration. All right. I'm just going to be doing a little bit of percussion on your lungs, okay?
Okay.
Very good. Alrighty, we're going to do diaphragmatic excursion. So what I need you to do is lean forward for me a little bit and cross your arms. Yeah, there you go. So go ahead and take a deep breath in for me. Alright, you can relax, breathe. And go ahead and exhale out for me. Alright, you can breathe. And if we measure 3 to 5 centimeters would be consistent with normal, and this is right at 5, so this is normal. All right, you can sit back up for me. I am going to listen to your lungs now, okay?
Okay.
I'll listen to the back, and then we'll listen to the front.
All right.
So go ahead and take some deep breaths in. Good. And then we're going to come to the front and listen to you. Deep breath. Good. And there's no adventitious lung sound noted with any of the breath sounds. So I'm going to have you lay down on the bed. I'm going to listen to your heart and look at your abdomen. You can circle. Alright, you can come on this side. Alrighty. So when we are looking at the chest and the heart, we are noticing that you might need to step around on the other side. Come over here a little bit closer. There you go. Alrighty. So when we are looking at the heart and looking at the chest, I'm once again seeing pulsations and respirations noted. There's no abnormal breathing patterns. When assessing for, any murmurs, no more murmurs or heaves felt upon palpation. So we are going to listen to a few different areas of your heart. First, we're going to come down from the fifth intercostal space. So we're going to measure down. And this is known as the PMI, or the mitral area of the heart where we are going to listen. So we will start there. Point of maximum impulse. And once again, that's at the medial spinal down to the fifth intercostal space. Good. And then we're going to come up to the tricuspid at the fourth space. earth at the third space, pulmonic at the second space, and aortic at the second space on the right. Very good. I hear S1 and S2 in all sounds. There was no sounds of S3 or S4. No murmurs heard. I'm going to check your pulses now. So we're going to do the temporal, the brachial, and the radial. We're going to come down to the legs. Can you lift your knee, bend your knees for me? Just bend them. We're going to do the popliteal, the dorsalis tibial, and the pedal, which are, all the pulses are symmetric, normal, and at a +2. Alrighty, so now we're going to look at your stomach. If you want to come back over here on this side. Alright, so when we are assessing the stomach, we are looking at a couple of different things. First, we are just inspecting, and upon inspection, there are pulsations and respirations noted. There is hair consistent with male distribution pattern. There's no peristalsis or striae noted. The umbilicus is inverted and is not showing any signs of the colon sign. Very good. So next, I am going to just listen to your stomach, okay?
Okay.
Good. And bowel sounds are present in all four quadrants. They would be at a rate of 5 to 30. All right. Next, I am going to listen to some of your organs, okay?
Okay.
So first, we're going to listen over the liver. And the spleen. Good. And there's no friction rub noted. And now we're going to listen over those arteries in the stomach, okay?
Okay.
So we're going to listen over the aortic, the renal, the iliac, and we'll divert the femoral arteries, which we would listen to. Next, I'm just going to percuss the abdomen. Good, and tympany is heard throughout. There would be dullness heard over a full bladder. All right, so now we are going to measure the liver and the spleen. And this is done through percussion. And we were coming down from dullness to resonance, and now from tympany to resonance. And when measuring that, we're right at 8 and 6 to 12 centimeters is normal for the liver. And we're going to measure the spleen. Good. Which you will hear resonance over the margins. Resonance over the costebral angle and then tympani over the margin. Next, we're going to palpate. We do not palpate the spleen, but we do palpate the liver. So I'm going to come underneath you. Any tenderness?
No.
Okay, take a deep breath in and cough. Good. The liver is smooth. It is not rigid. There's no calcification felt. And I'm just going to come over here and feel the kidney, the renal. Which are on the retro aspect of the stomach, and there's no abnormal palpable areas noted on either. All right, very good. We are done testing your abdomen, so now we're going to do your joints, okay?
Okay.
So first we're going to do with your legs, since you're already down here. So go ahead, we're going to be doing flexion and extension. So go ahead and flex your leg up and down. Good. And then bend the knee in. Nope, bend the knee. Bend the knee up and down. Good. All right, let's do that against resistance. So try to push, flex up. Keep your leg straight. Lift your leg up. There you go. Against resistance. Good. And then come down. Good. And try to lift that knee up. Good. And then down. Very good. And this would be done bilaterally to both sides. We're going to do abduction and adduction. So I want you to bring your leg out. This is abduction and adduction. And then we're going to do some rotation. So bring your knee like you're sitting like a man. This is external rotation, and then bring your knee in to touch the knee. Internal rotation. Very good. We're going to try to do these movements against resistance. So I want you to try to push your knees against my hand. Good. And then bring them out. Very good. All right, we're going to come down to your feet here. Can you put your toes to your nose? And then out. Very good. Can we do this against resistance? Good. And down. Good. We're going to do inversion and eversion. So can you bring your foot in and point it down towards the floor? Good. This is inversion and bring it out. Good. That's eversion. I'm going to hold your ankle and just rotate it for me. And we're just testing ankle rotation here. Very good. Can you stand up for me? And we're going to test hyperextension of the leg. So just, you can turn this way. And then just extend that leg back for me. Very good. And that's hyperextension. Very good. Perfect. All right. You can look at me. We're going to test some other range of motions with your joints and your bones, okay? So we're going to do first your head, okay? So I want you to bring your neck down. This is extension. Can you bring it resting? And then hyperextension. I'm sorry. This is flexion, flexion, extension, and hyperextension. Good. Can you turn from side to side? Rotate. Very good. And then, very good. And we're going to do all this against resistance. So flex forward, extend, side to side, and then ear. Good. Ear. Very good. Now we're going to do it with your arms and your shoulders. So can you flex like you're diving? Good. And then extend, and then we're going to hyperextend. Good. And then we're going to do abduction, which is out, and abduction, which is in. Good. We're going to do internal rotation like you're in the cop car, and then external rotation like you're being handcuffed. Very good. All right, you can just relax. Now we're going to do those movements against resistance, okay? So try to lift your arms up. Good. Lift them up. Try to bring them down. Good. Bring them forward and backwards. Very good. Now we're going to do your shoulders. So what I want you to do is flex and extend. Do supination and pronation. Good. And then go back to supination. Try to lift up. And then and down. Very good. Now we're going to do your hands, okay? So what I want you to do is just bring your hands up, open, make a fist. Good. Touch all your fingertips to your thumb, and then bring your thumb in. Good. Bring your hands out, and we're going to flex, relax, and come down. Good. And now we're just going to do that with our fingers. And down. Good. Now we're going to do these against resistance. So lift up. Good. Lift down. Good. And now we're just going to do your fingertips. Lift up and down. Very good. Can you open your fingers for me? Try to close your fingers against mine. Good. And then try to open them up. Good. Squeeze my hands really, really tight. Good. Okay. We're going to do deviation now. So bring your arms straight out. And we're going to do ulnar deviation and radial deviation. And just keep your wrist straight. Radial and ulnar. Radial and ulnar. Good. Very good. All right. Now we are going to test your spine. So what I want you to do is just come over and bend down and touch your toes. Good. And while you're down here, I'm just looking and it's testing for scoliosis. The spine is midline. There's no rigidity or abnormalities noted. All right, you can stand up. This is extension, and I want you to go all the way back and hyperextend. Good. Very, very good. Good. All righty. So now we are going to do a couple of different testings on your reflexes and your other areas of sensation, okay? So what I want you to do is just turn and walk to the door, just a heel-toe normal walk. Good. You can stop right here. We're going to do the Romberg test. I just want you to stand with your feet shoulder-width apart, and then your arms by your side. Very good. And there's no swaying noted, which is normal. So you can go ahead and have a seat right here for me. Alrighty. What I want to do is test some of your movement. So what I want you to do is really fast, in a fast pattern. Good. And then we're going to do tapping. Tapping. Tap, 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 tap. Fast as you can. Fast as you can. Very good. Very good. What I want you to do is look at me and hold your arms out and do your finger. Good. Finger to your nose. Good. Now do this with your eyes closed. Very good. All right. Very good. These are all normal findings. Next, we're going to do a couple of different sensory tests, okay?
Mm-hmm.
The first one is going to be stereogenesis. I want you to close your eyes for me. I'm going to put an object in your hand, and I want you to tell me what this object is, okay?
Okay.
All right. Open up your hand. I'll take this one. And close it, and tell me what you feel.
A coin.
Very good. All right. Keep your eyes closed. Next, I'm going to be doing graphonesia. So I'm going to draw a number on your hand, and I want you to tell me what the number is that you feel. Okay? All right, let me see your hand.
3.
Very good. All right. You can open your eyes. We're going to do a couple more testing on you. What I'm going to do first is you're going to feel me touching you, and I want you to tell me if it's soft or hard and where it is. So let me just show you. Let me see your arm. This is hard and soft, and you can say right arm.
Okay.
Soft on right arm, okay?
Okay.
Ready?
Mm-hmm. Soft right arm. Hard left arm. Soft left leg. Soft right leg.
Good. All right. Next, I want you to keep your eyes closed and hold your hand out for me. And I want you to tell me if it's up. Hold on. I'm gonna do your finger, and I want you to tell me what it is.
Okay.
This is up, neutral, or down. Okay? You ready?
Mm-hmm. Down. Up. Down. Up.
Good. All righty. We just have a couple more tests to do. I am going to test some of your reflexes, okay? So, just put your arm out for me. Just bend and relax your arm. This is the tricep, the bicep, and twist your arm like this. The radial, And what I need you to do is hold your hands together and pull, 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 pull. Good. That's the tibial, and then we're going to do the ankle test. And you can relax your hands. Good. And the reflexes were reactive. We would do this to both sides. And yes, that is the completion of my health assessment. Thank you.
Thank you.